Okay, can you explain to us from what year your pain or your problem started and what happened after that?
Yes. In October, late October of 2000, I had been walking to church. I went across the street. It was raining a little bit, and I just slipped a little bit. I didn't fall down. I didn't hurt myself. And I went on to church. But by the time I got out of church, I could feel my back tightening up. And then throughout the rest of the day, it got worse and worse. And finally, I have two daughters who are nurses, and they decided I'd have to go see the doctor because it was not getting better. So they took me to Kaiser, who's my HMO, and they took x-rays and said that I had inflammation of the lower back, and they prescribed some pain medication and some muscle relaxants and whatever. And I began to take the medication, but I got so ill, nauseated from it, and I was vomiting, and so I thought, well, this is worse than than the pain, and I decided I was just going to have to stop taking the medication and just wait. A good friend of mine stopped by, and she had been a patient of Dr. Farman's, and she told me, she said that she thought that he could do me a lot of good. And so my daughters took me there with the aid of a wheelchair and a few canes, and practically carried me in the office. And a doctor took a history and tested me and diagnosed me as the same as the Kaiser doctor, but he prescribed some for minerals, missing minerals that my body needed. And so I went on to follow his regimen, and by Thanksgiving time, I was walking again very well. And of course, he had promised me that I would be dancing by the New Year, so...
Did you dance?
I did that.
Oh, okay, that's great.
Thank you.
Okay, you said that was October 2000?
Yes.
Okay, let me...
Audience that I just recommend to the patients, if they need to go to acupuncture, chiropractic, physical therapy is fine, but the most important things to concentrate on root of the problem, which mostly is cartilage inflammation, and provide the food and minerals which the body needs. Once we provide this deficiency, we give back the health to the patient,